Bismillahirrahmanirrahim. Welcome to on webinar on obesity and chronic disease management. Mr. Dr. Mohammad Farhan, family medicine physician and our board member of Pakistan Business Professional Council for many years. Dr. Faisal Arshad, family medicine and physician, and have been a speaker in our council webinar. And all the participants, welcome to this important webinar on obesity and chronic disease management. Pakistan Business Professional Council for since starting of pandemic and earlier also have many webinars to educate the community for their healthy life. Council play a special role for protecting themselves under the pandemic, which the government of UAE has controlled in an excellent manner. And we all the residents and people of UAE are very thankful to the government and the special arrangement on the health side, especially on vaccine and on PCR services is one of the excellent work they have done. Side by side, I must thank Dr. Farhan Saab, who has taken up this task. He is our health side leader, and he did a great job in educating the community here. And we admire his frequent webinars on the subject to protect the community here. The subject is very, very important. When you say webinar on obesity and chronic disease, it is a statistic mentioned by all the speakers, especially that you can say by diabetic, blood cholesterol, blood pressure, all these are very chronic disease. And to protect them is certainly not easy in this area of United Arab Emirates. I will comment on my closing speech. Some, of course, Dr. Farhan Saab and Faisal Arshad Saab will guide you how to overcome this with whatever little experience. As I say, obesity is a chronic progressive disease that leads to a physical, psychological, and metabolic health problem. And I must say it is a global epidemic. Although with all the good facility provided in United Arab Emirates, it is challenging for each person to maintain. I admire the health services in United Arab Emirates is A class, and all the residents, they have advantage that they can go to frequently to test their blood, test their health, and see their doctors frequently. Not in other countries, this facility there. And from this webinar, I request everyone that they should do annual checkup in the hospital because everyone has his health card. Obesity management, it is important, is about improving health and well-being, not simply reducing number on the scale or weight. You have to work in a lifestyle. You have to change your lifestyle to have a great health of yours and to avoid the obesity. And especially the early intervention means addressing root cause and removing roadblocks. You have to care what is the reason, and every person has a different way of the reason for these diseases. So you have many ways to attend to it, but you have to be careful not to neglect it or not to linger on. As always say that if you attend in the same way, if you feel something different in yourself, immediately consult the doctor. Don't go on your own way of treatment or your friend or your relation to use such medicine or advices. I will suggest you have a facility of health card, go doctor the best way they will do it, and they will eliminate immediately. But if you go delay, then certainly you are asking problem for yourself. Every person is different in situation, and every patient weight is also different. So one has to take care of. So today's webinar will help us to understand the impact of chronic diseases and risk factor of fertility, the subsequent impact on antenatal care and birth outcome, a very important subject, especially when outcome is out of the birth outcome. This is to be careful, but we still admire the system the UAE has in this case. And identify issues relating to overweight, obesity, and the role of weight and fertility, pregnancy, birth, and birth outcome. Make recommendation for appropriate therapy and or referral in patient with pre-obesity or obesity, adopt techniques to work collaboratively to develop a nutritional plan. And I will now invite Dr. Farhan Saab to address to this webinar for guidance to all our community and members of the council. Over to Dr. Farhan.
Assalamu alaikum, ladies and gentlemen. Thank you very much for attending this seminar. We will start this seminar by the name of Allah. Bismillahir Rahmanir Rahim. Qul huwallahu ahad, Allahu samad, lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Sadaqallahul azim. My name is Dr. Muhammad Farhan. Thank you very much, Mr. President, Dr. Qaiser, for giving us the platform in the Pakistan Business Council, and we work together as a team, and in all the sectors we are working and try to make the good and healthy community. For today's topic is very important because during the COVID days, and we see the obesity and related to other chronic diseases have a major link. If you are obese, you have more side effects and you have a more trauma during any communicable diseases or anything. Today's topic is obesity and chronic disease management. Change slide. We will start with our introduction. Our agenda for today is introduction, obesity and overweight in adults, then children obesity and teen BMI increases is very common nowadays, statistics, then we will go for updated UAE statistics, then projection of obesity, prevalence in 2023, we'll give you the project that if we work good, what will happen, and if we will not work, what will happen, causes and contributing factor of obesity, complication of obesity leads to the chronic diseases, and then we go for chronic disease management and treatment of obesity. Thank you. Obesity, you know, is a very complex disease. Somebody who is obese involving as in means that he have an excess amount of body fat. Obesity is not just because of cosmetic reason or bullying reason. It is very severe medical problem that increases the risk of non-communicable diseases and health problems such as heart diseases, diabetes, blood pressure, mental illness, depression, dyslipidemia, and certain cancers also. So obesity is associated with the poor mental health and outcome and reduce the quality of life. Obesity results from inherited physiological, environmental, bad lifestyle, bad eating habits, physically no activity, and exercises choices which you will made it. And you will not know that at one point you will have all the diseases and your life pattern and you are socially cut off. Thank you. Obesity and overweight in the adult, just this is the classification of the small area. We will put our presentation in the website also for your education purpose. Weight that is higher than what is considered to be because in WHO and in the medical science, we have with the height associated weight, we have a grading. According to that, if you cross that height and weight and your waist, then we say overweight or obesity. The term known as body mass index is a criteria tool for making either you are normal, you are overweight, obese, or morbid obese. BMI is a person weight in kilogram divided by the square of the height in meters. Doctors are also measures a person waist circumstance to help guide the treatment decision. Weight-related health problems are more common in a man with a waist circumference over 40, and in women, the waist circumference over 35. Normal, the classification of adult BMI is the normal adult should be ranges from 18.5 to less than 25. We count it as healthy weight, and healthy person means the weight in kilogram divided by the square of the height in meters will give between 18.5 to less than 25 means the healthy individual. You have the apps you have available. You can do your weight and height and immediately you can get your BMI at home in 5 minutes. So try to do your BMI every month so you know where is your BMI standing. My consideration, if your BMI is more than 25, you have to go to the doctor and do the lifestyle modification earlier. Don't wait that this BMI ratio will reach to 35 and then you will be late. So 25 to less than 30 is overweight, where this is the alarm. You have to take the steps by diet, by exercise, by lab test, by follow-up with your physician. 30 or more is obese. 30 to 35 or less than 35 is class 1 obesity. 35 to less than 40 is class 2 obesity, and more than 40 or higher is class 3 or severe morbid obesity. So this is the classification. I want you to be always less than 25, but whenever your BMI reaches to 26, you have to rush to the hospital. Thank you. Children and teen BMI also, BMI age and sex specific and refer to that. The children body composition varies as the age varies between boys and girls. Therefore, the BMI level children and teens need to be expressed relative to the children. This is the percentile ratio, and this is the graph is very easy that underweight less than 5 percentile underweight, the body is thinner. That also you need a good diet to be on the normal. 5 percentile less than 85 healthy weight, 85 percentile to less than 95 is overweight, 95 more obesity, and 120 severe obesity. Thank you. We will go towards the statistics in all over the world or in the UAE. It is estimated that approximately 2 billion adults worldwide are currently overweight. And this is the major factor contributing to many diseases. So obesity is the root cause of many diseases. Percentage of the adults worldwide who are overweight, 38.9. Percentage of the adolescents worldwide who are obese, 5.6%. No country is on the track to meet the WHO 2024 target on obesity as defined by the BMI. So we have to work awareness and work hard and raise globally awareness to reduce the weight. By 2030, it is predicted that 1 in 5 women and 1 in 7 men will be living with obesity lifestyle more than 30, which is alarming situation. The highest rate of obesity at all BMI point are found in the WHO American region in both men and women. Thank you. UAE Statistics, the prevalence of obesity among the adults in UAE is 27.8% according to the National Health Survey done in 2017 and 18. The prevalence of obesity among the children and adolescents aged 5 to 7 reaches to 17.35 according to the last statistics. So can you see the adult increase in the obesity is 20 to 23, 2% adult with obesity by 2030. We are expected, but it shouldn't be like 40.6. So, and premature death with the NCD of all the non-communicable diseases will be high if we will not control the obesity. Thank you. This is we projected the prevalence of obesity in 2020, and all the countries are predicted we have to see a number of the rise in affected children by the obesity in the current decade. In all the regions, more women are affected by obesity than men. This is the global countries we put it that half of the people in these 5-6 countries are obese, majorly in US, China, India, Brazil, Mexico, Russia, Egypt, Indonesia, Iran, and Turkey and Pakistan. So these 5 or 8 countries have more than half of the obese person. If we work on these countries and make the awareness and make the health program, so it will decrease the overall obesity in the world. Half all the men living with obesity in 9 countries like USA, China, India, Brazil, Mexico, Russia, Egypt, Germany, and Turkey. So this is the statistics by that which country have the highest rate of male and female obesity in the world. Thank you. Now we can come to the causes and contributing factor. Obesity occurs when you take in more calories than you burn. It's a normal phenomenon when you eat more and physical activity less. So there is a disproportionate in the body and your body will get more fat and multiply cells and you will gain fat. Obesity results in a combination of the causes like family inheritance, lifestyle, unhealthy diet, inactivity, liquid calorie high diet, insufficient sleep, some diseases like Cushing where the hormonal imbalances and arthritis and prevalent. Why arthritis? Because you are not able to move and you are not able to walk, jog. So that's why with the cause of arthritis, you can't move and you eat a lot. Medications such as antidepressant, anti-seizure and diabetic medicine, antipsychotic medicine, steroids and beta blocker increase your appetite by some of the molecule and you eat a lot. Social and economic issue like unhealthy ways of cooking, non-availability of safe walking areas. So you just limit it to your home and then in one time you are gaining weight. Obesity can occur at any age, even in the young children. So we have to do the family BMI every month. So at least we know what is happening. But as the age, hormonal changes, and the less active lifestyle increase the risk of obesity. Pregnancy, some of the females have a pregnancy, and some during the pregnancy they have diabetes, which is called gestational diabetes, and they are not taking care of themselves. So after the pregnancy also they have to come back to the normal weight within some criteria, but they just gain weight, and after the finishing the pregnancy also they gain weight. Quitting smoking is often associated early with the weight gain, but if we follow the diet, so smoking, quitting is a good act. But if you weight gain, you can control it by follow up with the dietitian and family physician. And stress and mental health problems. Yes. Now from here, I invite my very good friend, Dr. Faisal. He is always there to support the community and Pakistan Business Council. He did many seminars and webinars with me. He always there to support the community, either local or internationally. He is family medicine specialist, my brother, and he will discuss some complication of the obesity and other two things. Thank you, Faisal. Assalamu alaikum. The mic's to you.
Walaikum assalam, Dr. Farhan. Sorry, I was not in town, so I couldn't make a good presentation for you. You're always very kind to invite us to such a webinars. As you have given a brief introduction, a very nice presentation so far about the prevalence of obesity and the risk associated with obesity and everything. As you can see now, everywhere in the world, obesity is being recognized as a disease. It's not a social thing, it's a disease now, because if you not take it as a disease, it's lead to multiple diseases, and most commonly the complication of obesity is the cardiovascular disease, which is a high burden on the society, and the patients are having complication because of cardiovascular outcomes. So as obesity, as you have discussed, it starts from the genetic factor, amount of food intake, and then also as you are not controlling your diet properly. In the modern days, I think the obesity is something else as well. Like what I understand from my practice is that what we have changed over the years, like our eating habit and style of living, we have tried eating more of refined food and refined grains. This is leading to excess calories that our lifestyle is not able to metabolize and utilize them, and that leading to excess of our weight. The other important factor is the good protein in the diet also help fight obesity, and the proper amount of protein we are not taking as well. The amount of high sugar intakes, syrups, especially fizzy drinks, all these calories later on converts to obese and adipose tissue, and then it become a cycle, like a vicious cycle, which in turns make you feel gain more and more weight. And now for Asian community or Asian population, especially in the MENA and Gulf region also, the threshold for obesity according to BMI is also being reduced. It's not like 20, 30 and above that you are obese. It's 28 or even less that for us to be considered as obese. So you rightly pointed out that once we started gaining weight, our BMI jumping above 25, we have to be very cautious, consult our family physicians, take their advice, and if there are any modified risk factor that we are having, we should address that and to try to control that. For example, as you discussed, secondary causes of Cushing-Boyd disease, other metabolic disease, diabetes, a very common thing which we are noticing in practice, and especially in children, and they are having these insulin resistance, and that is leading to so much metabolic problems, and obesity is one of them as well. So as you have seen, the complication of obesity starts with cardiovascular, insulin resistance leading to diabetes in the future. Risk of cancers are there, especially in the females, endometrial cancer and other ovarian cancers are there, especially for obese people, the arthritic changes in the joint because of the overweight, the osteoporosis and the osteopenia, the bone development, all these comes also as a complication of obesity. So when you start, the better is prevention than to treat all these burden of disease. So think obesity as a disease. Once you start having a high BMI, change your lifestyle. If the lifestyle is not working, you have to consider using certain metabolic agents that can stop the progression of this process, and then that can prevent future further disease complication as well. So based on these things, maybe as you go forward, you can control your disease and make patient control of their disease. The patient education is also very important aspect. Like, they have to understand that what complication they can have. And as you rightly mentioned, the prevalence is increasing. Like 30% of the world population, if you'll not do action now, would be obese. Like as you said, 1 out of 4 every person will be obese. And then these obese people will put an extra burden on the healthcare system. Thanks God to we are in UAE, and thanks to the government, and thanks to the health system here, that we have access, easy access, and we can visit our doctors, we can take advice, and we can control on this parameters of obesity. Especially childhood obesity has to be addressed, because if you take early action of controlling obesity in the childhood, then the later of chances of having complication and developing obesity in the adulthood, because in adult it is really difficult, and the other important aspect of obesity is it's like a disease which is uh, in fact like diabetes. Like, if you stop your lifestyle modification, it will regain, you'll regain your weight altogether again, and maybe sometime you regain more. So you don't have to think that it is it's like a one-time solution, or once you reduce your weight. I think it's a ongoing process. It's a continuous change in the lifestyle, proper sleep, proper diet plans, regular exercise. And then if all these measures still you are unable to control your disease, you have to go to a physician, take their advice. There are number of medical options available now. Even if the medical options are failing, their surgical options are available for people who are having very high BMI, like above 40. The metabolic surgeries are there to help you reduce your weight, and all of these will help you control your disease so you will not progress. The obesity itself, another fourth important complication or the chronic disease that can come is the depression episode or the psychological problems. You will not feel confident, your body shaming and body figure and all these things, it will come and play a part, especially in adults or adolescents and teenage groups. So we have to be very careful in managing these type of people, give them confidence about that it's manageable condition, and then they can overcome that. These are, I think, few points I want to address regarding obesity, and in community involvement in that program. We have everything available to us. We have to just spare some time, do some exercise, take care of our diet, and take advice from our physicians. And I think we will be able to manage this disease very well. Thank you, Dr. Farhan, for excellent topic selection and introduction. I hope I can contribute more.
Yes.
Sorry for that, but thank you very much.
Thank you, Dr. Faisal. First of all, you are not in the country and from overseas. You just joined, and just stay safe trip and safe comeback. And thank you very much. Thank you very much for valuable information. I will continue it. Let's put the slide for complication. Yeah. So you just got a very good information from Dr. Faisal, and thank you very much. He's not in the country, but he was available for us, and he gave a very, very, very informative ideas and information regarding the complications and obesity management. Now we will continue the more complications of obesity in my eyes, right? Osteoarthritis and, last 2 to 3 years, severe COVID pneumonia. Whenever we see the obese patient, we are over alert about it because the risk of obesity and risk of COVID is very high due to the complications. Psychological problems such as anxiety and depression, as Dr. Faisal mentioned. Then there is a disability, low self-esteem, social isolation, stigma, and lower work achievement. Next slide, please. Chronic disease management. The National Institute of Health guideline defined the metabolic syndrome in 3 or more of the following traits. Like large waistline, you have high cholesterol and triglycerides level, you have reduced good cholesterol level, you have high LDL, which is bad cholesterol, increased blood pressure, elevated blood sugar, which can cause pre-diabetes and then diabetes. If aggressive lifestyle changes such as diet, severe exercise, control your weight is not enough, your doctor might suggest some medications also if you need it. How you have to do follow-up checkup every 3 to 6 months. You have to control your blood pressure with the help of your dietitian and family physician. You have to control your cholesterol and blood sugar level. Just do the blood test, and my concern is to decrease your as a normal baseline. You have to control your HbA1c, which is the 3-month sugar level, which should be between 5.2 to 5.7, less than that. Regular follow-up with your family physician is required until the desired weight and above mentioned parameters are met. This is the special task which we as a government of Abu Dhabi, we are working in the private sector, and our president and our all UAE health sector always do the prevalence of any disease. They just focus more on preventing the disease instead of just treating it. So we have very good tracks available, we have very good parks available, we have very good health network available, we have insurance available. So at any level, either you are poor, medium class, first class, VIP, everybody have the same health system, so you can have the benefit for that. So I thank you all. Treatment of obesity, these kind of 2-3 things which I want to emphasize are: whenever you eat less. Cutting calories means, what do you mean by that? The cutting calories means a normal individual has to take 1200 to 1500 calories. We have to eat by calculating the calories, which we are not doing. So we are eating, and maybe we eat 3000, 4000, and we don't know we need only 1200. So overburden of the calories leads to obesity. Feeling full on less means if you want to eat and you will not feel full, and though you again eating. So that's why if you drink lots of water or some which diet which is fiber related, it will not impact more on obesity. Healthier choices eating is always available. Google is there, apps are there, and you have all awareness are there, and you see the dietitian every 6 months is better. Restricting certain foods means you have soft drinks which have high sugar level. We have junk food. We have to restrict it. Sweets thing, oily thing, fried things we have to avoid. We will go for fruits. We'll go for vegetables. We will go for fresh soups. We will go for water, and we will go for fiber diet, which is less calories. Go back. Yes. Behavior changes and support group. We have obesity awareness campaign should be there. There is marathon is there. Weight loss medications are there. But I tried and I recommend my patient to do diet and exercise. Medications when your obesity is not controlled and you need medication and endoscopic procedures and weight loss surgeries more of those who are obesity more than 32 or 34. But initially, if you track this disease without any medication, without any surgical intervention, you can control your obesity and you can prevent many diseases like diabetes, hyperlipidemia, stroke, heart diseases, diabetes, and cholesterol and mental health. This is the small 35 to 45 minutes webinar for awareness. We will come back again every month to give you the topics. If you have some topics, please feel free to write us on our email, which is available in our website. And together we will make a healthy world and healthy lifestyle. And if you are healthy, your family is healthy, so you will live longer. And nowadays, a government of Abu Dhabi started longevity trial also, which is a very good act. I'm the part of, and we are doing the research on longevity trial. And by that, they understand that how much stress we have, how much we can do the jogging, walking track, how much exercises. So every age individual will be healthy. So we are very thankful to government of Abu Dhabi that they are taking these measures to always making the healthy community and prosperous. Thank you very much. Assalamu alaikum. This mic now is to our president as a closing, Dr. Qaiser. Thank you very much.
Thank you, Dr. Farhan Saab, for a great presentation and advices and guidance to the participant. And of course, this can go in YouTube and can go in Facebook. And that's good for people who will adopt, can have a good healthy life. And thank you, Dr. Faisal Arshad, with all your non-present, still you have attended, and your council is very thankful to you every time you participate. I'm sure with this webinar, you have a lot of information, but the few things I will request all the participant listener that they should look the lifestyle, how you are living. Most important, as mentioned by Dr. Farhan Saab, obesity starts it, and if you do not control, it can complicate not only for obesity, but it travels, you become a diabetic, you become cholesterol problem, you can have many complications, gut problem. These are all not good for your health and activities. So if you control in the beginning, it's very easy. Lifestyle goes with dieting. You should go with diet and take care what your intake is. Concentrate, regularize your diet. You plan your diet that you are taking living type of food. When I say living type of food, which is not processed food, avoid taking the processed food. And that is the biggest cause in the world of obesity. Like I say, the soft drink, or I can say those fast food things, you have to take care of living food and wholesome food. Wholesome food, like not a white rice, you should take brown rice, and you should take care of your bread, should not be like of white bread. You should try to take brown bread. These are few steps if you take, possibly can be helpful for your family, for everyone. And try to take plant-based product. Plant-based product, you can understand that should be plant-based. And as Dr. Faisal mentioned, is that protein is very important. You should regulate your protein. And then you take the water-rich fruit and vegetable. What is the water-rich fruit and vegetable? Is normally like watermelon and melon, who's not solid sort of a thing. You will enjoy these foods and your body will enjoy, and the outcome will be very good. Other very important thing to follow in your routine is walking is very important. You should take care of doing walking and 20 minutes exercise. You can choose 20 minutes. You can give this 20 minutes to your in your life that I want to give every day 20 minutes. And you can do either yoga, you can do many ways of things, cycling, anything you can do for in this 20 minutes. But don't go for a gym for 1 hour or 2 hours. You cannot maintain that. Try to maintain 20 minutes of this. And of course, as Dr. Farhan said, sleep is very important. You must sleep 8 hours. Sleep will restore everything. So these are the important things you should take up from this webinar. Lastly, I will say so little guidance more on water. You know, this somehow we are drinking desalinated water. This bottled water. This water bottle is in plastic. This water bottle has a mercury. This is one of the cause also for all this chronic disease. So try to review your water intake, mineralize the water. There are a lot of water companies here. Try to get your home water mineralized. you'll see the change. I give an example. I have a friend here who just left to Switzerland 3 days ago. I just talking in this morning with him. When he was there, his blood sugar was 135. And when after 3 days, his blood sugar is 90. And he said, how it happened? This is all because of water. So water is one of the cause, and Pakistan Business Professional Council is taking up this subject and possibly will be attending with the government department how we can mineralize the water, how we can have standards to be done here so that everyone should choose those mineralized water. Like glass bottle is also important because this plastic bottle is a problem, because if it is remain in the sun on warehouse, it do contaminate. I'll give an example. I was in a conference yesterday with Arab Water Convention, and the discussion was there how to save water and how to improve the water quality. There's a lot of ways that we can save the water ourselves should, because now you must have heard that in Saudi Arabia, in Neom City or in Riyadh, there is scarcity of water, they're feeling it. And they're making their steps how to avoid this thing. So we all with this, I'm requesting everyone to save use of water, should not throw water out and use a quality water. You have a tank, see that it has been properly sterilized, properly used, properly cleaned. So the water intake is so important for your health than anything. Make sure the drinking water is a good water. With that, I will close, and I'm looking forward to the next webinar. And side by side, I make an announcement of this another program which we are doing in the name of, you know that in Pakistan, we have a flood, and this flood has disrupted nearly 1/3 of Pakistani with many deaths, and many people's lives are still in trouble, because this flood has taken away their lives, especially their houses, their education, it affected their health, everything. It's normal day of life. UNICEF is working good work for Pakistan since it happened, and they have approached the Pakistan Business Professional Council to conduct an event here to familiarize for awareness. And this event is going to happen on 28th of February. I request everyone from this that they should come and participate and join and see how this can be. This is in line with COP28 also. You know, the COP28 climate change event, we are lucky that it's happening here in Abu Dhabi, and we would like that this will be the first event we are conducting related to climate change, because this flood happened because of the climate change. And on that reason, we are inviting all the ambassador, business council, business community people. Is not limited to only Pakistanis, it limit to all the community. This climate change is for everyone. We have to protect this planet as early as possible, just to avoid this, the changes in the environment, the misuse of the environment. So we all as a community to help them to make a healthy life this. And with this, I'm requesting everyone to come forward and join this. It will be in Abu Dhabi Chamber of Commerce on 28th February at 11 a.m. So please register yourself there, and I see you there. Thank you very much. And again, thank you for listening, and thank you for joining, and thank you, Dr. Farhan and Dr.